of all, thanks to the experts for sharing your expertise with us, but also for your tremendous work you are doing on this important topic. And I really think you are like guests in a parliament where a lot of colleagues are fighting for the rights, human rights in general and trans rights especially. And I also want to thank both committees for organizing the hearing, especially when it comes to access to healthcare. I think there is still a long way to go in the member states, but of course also as the European Union in general. And I also think that this is like really important to have this conversation today in a time where we can see a huge backlash in a lot of member states, where especially trans people, but also others from the LGBTI plus community are facing discrimination and violence, with a lot of attacks also this year, also in my member state in Germany. What I would like to ask both of you is a more concrete question on what do you think we should do at European level? My colleague Mark Engel already mentioned like best practice exchange of you and some other examples for what maybe could also be organized at the European level. And I would like to ask you a little bit more into this because, I mean, you are fully aware of this. What we are often facing is that we have to deal with national legislation when it comes to securing also human rights for LGBTIQ plus people. So this is what I would really like to ask you to have a bit more of a concrete perspective and examples for what we should address at European level, besides of some examples already mentioned.
It really boils down to sort of 5 quite simple criteria. And if you'll indulge me, I'll just very quickly go through them. One is a procedure for the complete rectification in all identity documents of gender identity, including non-binary gender identity based on self-determination. Secondly, the procedure should be a simple administrative process that is, if possible, cost-free. Third, the procedure must exclude any requirements such as medical or psychological examinations, diagnoses, interventions, certifications, or divorce requirements in some cases, which UN human rights mechanisms have found to be physically or psychologically harmful, pathologizing, and in violation of international human rights standards. Fourth, the procedure and the changes, corrections, or amendments to the records should be confidential, and the new identity documents should not reflect the change in gender identity. And that is the international human rights standard for gender recognition. I just thought it would be useful to raise 2 points. One is about the public health evidence, and the other about the human rights standards related to gender identity recognition. So in terms of the public health evidence, as I'm sure a lot of the people in the room know, the violence and discrimination faced by trans and non-binary individuals is exponentially higher than that of the general population. And there have been several studies in support of this. The other studies that we've looked at include much higher rates of mental health issues, anxiety disorders, depression, suicidal ideation, and the study that I think is really apt here is a very large cross-sectional study done in the US of trans and gender diverse people. And what was interesting about that study is they wanted to look at the difference between those jurisdictions which had gender identity recognition laws without some of the abusive requirements that have been referenced, and those that did. And what the study found was that there were significantly higher rates of anxiety, depression, suicidal ideation among those jurisdictions in which gender recognition was unavailable or available only at a very significant cost via legal proceedings. So I think there's a very robust public health evidence base as to why legal gender recognition is not just an important issue in terms of the human rights of self-determination, but also as a public health issue.
There are several important issues that should be addressed. First of all, in a lot of European Union countries we have good legislative, but the legislative is not implemented, and we should supervise the implementation of the law. Second, in different European Union countries, there is no obligatory seminars and courses regarding sexual health and LGBT-specific healthcare issues. So it should be implemented within curriculum of medical school, medical studies, psychological studies, and other professionals that are included in healthcare of transgender people. There are a lot of studies regarding the well-being of transgender people and their mental health. When the access of mental health process of transition is denied, and there is no adequate healthcare protection, there are data that strongly points out the higher levels of dysphoria and other mental health care issues. Regarding, for example, results of Fundamental Rights Agency LGBTI survey from 2019, 34% of trans people feels discriminated by healthcare or social services personnel in the last 12 months. So, of 3,463 participants, 65.7% of them who already accessed at least one transition-related intervention, nearly the half, 49.3%, experienced restrictions in access to transgender health care. So, regarding the low number of competent professionals, unfortunately, it is not something that is honored among our professionals. So sometimes we lack support from our institutions, from our health ministries. And we invest a lot of, like professionals, of our personal time, even money, to educate ourselves and to get appropriate education and competencies. Therefore, the WPET initiates Global Education Institute, and the EPET launches EPET Summer School and also a conference. So it is a platform where professionals can be educated, but without adequate support from projects and from our health system, it is really hard. It is also hard to work when you are subjected to the threats or of different anti-gender movements. So they question your professionalism, your competencies. Evidence-based practices are being misinterpreted. Data has been misinterpreted and misused in order to disqualify you as professional. It is not as, for example, you participate in, for example, transplantation of the heart. It is just a different scene within our professionals, within the mental health and the health care. So there is discrimination on several levels in the society that reflects on trans people, within the professional system, and then within the institutions. Regarding the processes of retransition and detransition and regrets, it is very, very important that professionals who work with trans people are competent and that people got all care according to the standards of care. There are holograms of procedures. And when everything is done properly, then the chances of regret are very, very low. But when you do not work according to the standards and you lack educated people within your healthcare system, then these data regarding detransition and retransition are a bit higher. As in each medical procedure, there is risk, but if you respect and do everything
Go finish, please.
to standards, then it is how we can remain competent competent and secure, that there are less chances of regret.